Yeah, and can you tell me please about yourself, about background? What's your name? Where you from? What's the condition that brought you to the clinic? Uh, that's it for the beginning.
So my name is Sue. I've come from Australia. Um, I grew up in Australia, went to school there. Um, my most recent job was teaching English. Um, I found out that I had dry macular degeneration um, many years ago, maybe 15 years ago. It was very early. I found out my ophthalmologist was telling me I was one of the youngest people she has ever seen with this condition. So, but nothing was happening. It was not affecting me. I was not losing any eyesight. I would go and have checkups every year and it was staying the same. I ate healthy, I lived healthy. Then suddenly sometime, actually it was after I had the 2 COVID injections, the vaccines, I was teaching online. It was during the COVID lockdown and I started to lose my eyesight. I went to several optometrists thinking maybe I'm getting older and I need new reading glasses. I went to maybe 3-4 optometrists, got 4 different glasses and it wasn't improving. At the end I went to my ophthalmologist and I found out that I've developed geographic atrophy in my macula, which means I was losing my central vision. After many tears and crying, my family and I started researching, looking for treatments. I was told in Australia, basically I was sent away with a book where to buy magnifying glasses or a guide dog. I was told that there's no treatment, they can't help me, I'm just going blind and I have to accept it. She told me that I had the eyesight of an 80-year-old. I'm in my 50s. I've always been active. I'm still working. So I couldn't imagine just going blind after being a sighted person and doing nothing about it. So we started doing research. We came across this place, Swiss Medica. I got in touch with the doctors here, sent them my medical records, my x-rays, and they said they could help with using stem cells. So I flew over here. I've had the treatment, and apparently now I have to wait at least 1 month before I start to see results. I'm very optimistic, of course. I've done a lot of research, along with a few, my daughter, my sisters, family members. We've read about lots of trials with stem cells injected, behind the eyes, and how powerful they are, and they regenerate cells, and this is what I've just had done here. So I'm looking forward for the next month to 3 months to see the results. I've had a very good experience here. The people here in Belgrade are wonderful. Everybody's very hospitable, very friendly. The doctors are very caring, the nurses, everybody, all the staff. They go out of their way to make us patients comfortable as possible. All I can say is I don't know if this is going to work. I'm hoping it will. But as for the treatment here, my experience here, it has been nothing but positive. I've had the best experience here. I've met some wonderful people. The place is state-of-the-art equipment, clean, quite legitimate. It's everything I'd hoped it would be. So if you're a person with macular degeneration, particularly dry macular degeneration with geographic atrophy, and you come across Swiss Medica here in Belgrade, don't be scared. They are legitimate. I was a little bit worried at first. I was suspect. I wasn't sure. You know, when you're on the other side of the world, you don't know who's real and who's not, and who. But yeah, this place is real. It's legitimate. People here are wonderful. I've received the treatment and just basically hoping that it work. That you know my body takes to it and I have a positive response.
Okay, thank you very much.
Okay.
Actually, usually I ask a lot of questions, but now you have
I told you
everything. That's I just didn't want to disturb you. But I want to mention that probably you had some fears, obstacles. You scared a lot about something specifically. Can you specify what you were scared of?
I was scared that now that I'm here, I feel a little bit embarrassed to say that I was scared of coming to Belgrade. Okay, I was scared that you know, I was thinking, is this a real clinic? Do they really know? Do the doctors really know what they are doing? Are they really specialists in stem cells? Or are they just saying they know what they are doing? You know, and you hear it, but you know, back home also we hear a lot about scammers. Are these people scammers? Why? Okay, so they're telling me they are a Swiss company, but they are based in Switzerland, but they are in Belgrade, and there's clinics all over, you know, all over the world. And then when I got the bill, the bank was in another country again, and I was a little bit worried. Mostly I was worried about the treatment. I was worried about the efficiency of the doctors. How good are they? Do they know what they're doing? Are they real specialists in stem cells? Do they believe in what they are doing? Although I felt comfortable once I had a Zoom meeting with I forgot the doctor's name.
Dr. Alexandra, probably.
Yes, I had, and that made me comfortable as well. We also, after the meeting, I wrote down some questions and I called a couple of times and they set up for a follow-up meeting. They answered all my questions. So after that, I thought, yeah, this is it. You know, they told me they've had other patients with dry macular degeneration, with geographic atrophy. And unlike some other places in the world that I came across, I did come across other clinics who say they specialize in stem cells and they've treated people with dry macular degeneration, with geographic atrophy. They promised me the world. Yes, I would be healed. Yes, my sight would come back. That you know, there will be, and I just thought that I don't think anyone can really do that. That made me a little bit, so I didn't go for these places. Whereas here, I think the doctors were more realistic in trying to manage my expectations. Yeah, so that sort of gave me reassurance.
Yeah, and have you got any concerns regarding stem cell treatment? Because there are a lot of different information online that you can find. For instance, it causes cancer.
Yeah.
It could damage someone's health. So have you got any concerns about it? Because you mentioned that you've done research by your own, but probably you also have already consulted with some different doctors
Yes.
in Australia or in different places. Can you please elaborate more about that?
Yes, in Australia, I did try and get a second and a third opinion. The doctors really didn't want, they didn't know much about stem cells. I got sent away, to be honest, every time I mentioned stem cells to any doctor in Australia, because they're not allowed. It's illegal there. It's not approved. It's not used. If there are any doctors who believe in it, who are doing research on it, I didn't find them. So I cannot say that's all doctors in Australia. but the research, I did come across research that said, it said that stem cells do not cause cancer. Okay, I think the types of stem cells that have been used here, the first ones are my own. I forgot that's from taken out of my bone marrow. So, and that's what was injected directly in my eye socket. So I wasn't worried about that at all. I knew my body would not reject it because it's my own stem cells. I was a little bit concerned about the umbilical cord stem cells, but again, so it wasn't just me that did the research. Myself, my family members, who understood a little bit more about medical words. My daughter, my sister, my kids, my niece. Actually, one of my nieces helped me a lot. She understood more what she was reading. So anything that I didn't understand, I would go and see her. And what we learned is that umbilical cord stem cells are harmless, and because they are, how can I put it, innocent. They're just, the body's, it's unlikely that the body would reject them, and that they do have the power to, they are very powerful. They've got the power to also regulate and modulate the autoimmune system. I didn't know this years ago, but I've learned that my condition, which is the macular degeneration, is an autoimmune disease, and that I needed something to regulate my immune system. So I think I don't know whether I'm going to regain some of the sight that I've lost. I hope I do. But I think if I don't, at least what the umbilical cord stem cells will do is regulate my autoimmune system and slow down the progress, because this is a degenerative disease. I think I have to weigh out the risks against the benefits, and I think for me I'm an active person. I've always worked, I've always been active, and I'm not a person who sits still. The benefits outweigh the risks by far. I mean, so I'm willing, that's why I thought, I was willing to try it.
Thank you very much. I think that's it. Probably you can say, you mentioned before about that you were afraid coming to Belgrade. What's your first impression about Belgrade, Serbia, Serbian people?
I want to come back as a tourist. Serbian people are the warmest, kindest, most hospitable people I have come across. I will definitely come back here as a tourist. I have had the best experience. I actually regret not knowing this before I came, or I would have taken more time off and maybe booked an extra 5 days just to go and look around. It's a really beautiful, it's a really lively atmosphere. Everywhere you go, everyone you see is helpful, everybody's very friendly, everybody's hospitable. Wherever we didn't need to go out to eat, because here at the Iron Clinic we get fed. You do not go hungry. But my daughter and I wanted to try some, wanted to get out of here and try some Serbian food. So we went out a couple of times. You get complimentary rakia, of course, to try, or complimentary dessert, complimentary Serbian food. The atmosphere is just it's just very, very friendly. I felt very comfortable. I felt at home, to be honest. I felt so comfortable. I felt better than at home. It's just Serbian people are just happy, hospitable, kind, proud people. And I would definitely come again just for a visit. I'm coming back to Serbia as a tourist.
Nice to hear that.
Yeah.
Yes. Nice.
So, and that's the truth. I've exchanged phone numbers with people. Yeah, I can't wait. My daughter. I have one daughter who lives in London. She's come to visit me just for the weekend, and she's also coming back with a friend of hers to Serbia. We love Serbia. We love Balkan people.
Yeah, nice. What have you seen or heard about Swiss Medica that you decided to go? Because I assume that you talked to or you reached different clinics around the world,
Yes.
but you decided Swiss Medica. Why?
To be honest, I did come across other clinics. I've heard about other clinics. I don't want to mention them. I hadn't heard about Swiss Medica. I came across Swiss Medica by chance. Google, I almost went, I was ready to go and commit and pay the deposit and go to another country, another clinic. Something, I don't know, it was a gut feeling, intuition. Because the other clinic didn't, they just gave me the stem cells were intravenously injected. They didn't treat the eye. So it was like, we'll give it to you intravenously and let the stem cells do their work. They'll find their way to inflammation in the body. That's the one thing I learned about stem cells apparently. But I wasn't happy with that. I'd heard that in the US there are several clinical trials, not clinics. They are currently doing clinical trials where they take out stem cells from your bone marrow and inject it in the eye, and I've read about that, and they've done phase 1 and they've had some really positive results. So I thought they're up to phase 2 if the stem cells caused damage, they wouldn't get to phase 2. So that's what I learned about clinical trials. But I don't want to wait for the phase 2 and phase 3 and for the approval, and then that'll be 5 years. This is a progressive disease. So after deciding to just go to another clinic and just get I couldn't find anyone that injected it behind the eye, and when I did find somebody in another country, I didn't trust them. I basically just started Googling more. I put in, I Googled stem cells and macular degeneration in Switzerland. I came across Swiss Medica, started researching it, reading about it, contacted you guys, talking to you. It was after I talked to the doctor and to Karen, the patient coordinator. They were very helpful. Every time I called, every time I asked a question, they would call me back and set up another appointment. And also, I think your work, all the testimonials. I decided this was more direct. I found out that the treatment would be focused, so in the eye and intravenously administered. So that's like I'm increasing my chances. That's why I decided to come here. It was the treatment, really. It was more to do with the treatment. So I'm getting my own stem cells injected in the eye socket and the umbilical cord cells administered intravenously. So I'm increasing the chances of success.
Okay, thank you for sharing that.
Thank you.
And what would you do if you were the owner of the clinic? What would you do to be better in terms of how we can be better? What should we improve?
You can't. I've had a fantastic experience. Anything I've needed. You know what I loved most about the way this place is run, the way you run this place, is if I speak to one person about something and it's not their job, they don't tell me it's not their job. They pick up the phone and they call the person whose job it is, and then next person comes to my room. I love that. Like, I think I've come from a culture where if you ask somebody to help you with something, if it's not their job, they say, go see that person, that's not my job. I was not sent away for anything. They don't say, oh, go see that person. They call that person to come and see me so they can help me with whatever my inquiry is. Maybe change the mattress in room 3. It was uncomfortable. And the hairdryers just the hairdryers in both my daughter's room and mine didn't work. But as far as the service, the people, I can't fault you, you know. I wouldn't change anything. The service, the way you run it, the drivers, they pick you up from the airport, they drop you off at the airport, you want to go try something, they take you there, bring you back. It's clean. I wouldn't change anything. Like I said, just physical things, like if there's one mattress was uncomfortable, change that. Or I think the hairdryer maybe is old in the room, or just change that. That's nothing. As for the service, everybody, from the cleaners to the doctors, has been wonderful.